very interesting discussion between the Minister, Mr. Georgiadis, and the Presidents of the committees, with the contribution as a coordinator, a moderator rather, Mr. Apostolos Mangiriadis. I should like to call everyone to the stage here so that we can kick off this very interesting discussion. Thank you very much, Mr. Spyridonias, Mr. President. Hello, I'm Apostolos Mangiriadis. I'm a journalist with ERT, and we will be discussing today about the healthcare sector in a changing world and whether we're ready. We've already made the introductions. Let's move on to the discussion. Good morning, Minister, and thank you very much for being with us today. Now, I've been reading the Draghi report for Europe and on how it needs to position itself against the global competition in the years to come. There's a special reference to innovation, which may help competitiveness of the EU. Draghi says more investments in innovation and research and development in covering the gap as compared to other advanced countries in the world. It's obvious he's talking about the United States of America, China, and all the big investments made in these areas of the world. Now, what happens in Greece? It's an aging population with ever-increasing needs and a health system that, well, you know this better than anyone in this room, is trying to move past the children illnesses and baby steps and everything. And you know what the situation is. How do you, as the government, are aiming at resolving this problem and increasing the access of patients to innovation? First of all, thank you very much for the invitation. I've been here since early in the morning. I mean, I've overstayed my welcome, I think, because I had breakfast with the PIF and the medical devices and diagnostics companies here, but it's always a great pleasure to participate in the events of the AmCham, always. Nicolas, Mr. Bakatselos, had to fly to the United States, no problem, but we have Elias here. Here is Elias, who always steps in and organizes all the events very capably, and I should like to thank very much Maria Olsen, the DCM, who was here. And I must say that with the AmCham, I've had a timeless personal collaboration, no matter what position I was serving from. Now, back to your question. Regarding the European level, Europe is absolutely certain to be losing the competitiveness war. Mr. Draghi is not saying something that is not reinventing the wheel. It's something that one can see very easily. The United States are dashing forward. China is running forward. India is now moving very fast forward. And Europe, year after year, is taking a small step backwards. When Europe was the home country of innovation alongside the United States, is not even running second. It's in position number 3, dropping to position number 4 in the world. So something is not right. Now, in order to defend European competitiveness and the proper course of Europe, the Greek government took the stance it did in the first summit of health ministers on innovation. And our viewpoint was that Europe must not be deprived of innovation. And if we believe that we can extort or blackmail the companies as the European Union to make them do what we want, it is more likely that the gap between us and the divide between us will grow, because these companies have many more choices outside the EU. And so Europe must realize that it's not alone in the world. It is indeed undoubtedly a very big market, but it's not alone. So it must take into consideration in its decisions what they do to become less bureaucratic, more pro-investment, faster. The Draghi report is a beacon of hope. Now, I don't know whether it will be adopted because it contains some amounts that is asked, something like 800 billion to be given for investment in Europe, and this is a matter that is far above and beyond a simple report, but it's a key issue for European politicians. In any rate, what it says in there is correct, and I hope that it is adopted, because for Greece it would be a great thing to adopt this report. Let's move on to the brass tacks, as it were, local-wise. Greece has made significant progress regarding the support of innovation as of late, and I'm very proud of that, because in my previous position, my portfolio included innovation in general in Greece. Greece went higher in the innovation refund absorption 10 places in 4 years in the European Union standings. I mean, from position 26, we went up to position 16. And this is the fastest increase of funds for innovation absorption. We created Elevate Greece, we supported startup companies, and of course, we made the investment clawback, which was my first law as the Minister of Investment in 2019. So the Kyriakos Mitsotakis government over time has shown that innovation and support is something of interest. It is of our interest, in fact. But many a time in life, what people wish collides with reality. It clashes, and this is a rather painful moment in people's lives, and it's a good thing to try, as far as possible, to be able to combine these things. Now, what is reality? The reality is that innovation in pharmaceutical industry and medical devices is a costly sport. It's not just a nice, abstract notion, it's something expensive. And all the more so, innovation is not produced in Greece, it is produced elsewhere in the world, so it is an expensive imported product, which must fit in closed budgets, because what the sector can do is very limited. And it should be of note that the entire analysis of various future discoveries is that innovative products will not be reduced in terms of production, they will be increased in an increasing rate. The very advent of artificial intelligence in synergy with quantum computing, which increases exponentially the computing capacity, creates the conditions to have a cosmogony in the area of healthcare. We will have cures for incurable diseases today, which will prolong people's life expectancy. On the other hand, for people who do my job, it's very, how shall I put it, it is provocative. So who will fund all this progress? Now with PIF, with the Pharmaceutical Innovation Forum, which is focused on innovation, because others focus on other drugs, but they are focusing on innovation, PIF. They have the first institutional role of speaking about these things. Well, not to say that no one else can say anything, but they have the first position in all this. So we've done quite a lot of discussions with them, and I want to thank PIF and Mrs. Barmpetaki, the president, my friend Labrina, who has shown to be a leader in handling these issues. So we have come up with a roadmap, I would call it, that can cover the gap that we have in Greece, which is we have less of an entry of innovative drugs in Greece than what we would like to have, which means that some Greek patients find it difficult to have access to the treatment they need. If someone needs it, we'll go through SEEP, we will find a solution. If the doctors say that this is what they must take, we might give them, but this is not the proper way forward. It is rather of a patchwork, and trying to patch things up there. But we must find a point of contact with innovation. And I think that this memorandum of understanding, signing between the Greek government and the pharmaceutical industry on this sector is very important. You call it a channel, we call it a channel of innovation. You call it a channel of a transitional compensation or reimbursement, but it's the idea of a specific fiscal area where clawback will be near zero, to give innovative drugs a better entry in the market. We need to clear that in the next years we need to know how much we're paying for what. All these are ideas we have adopted in order to build this environment that will allow for more innovative treatments to come to Greece and more medical devices and diagnostics. Despite our rebate that we have recently, I believe that there again we can see that the ACAP is moving forward. The list of vendors is already there, and we're trying to codify everything so that we know what our hospitals will be purchasing at a stage through the ACAP. We will have a similar roadmap that will allow us, dear President, to allow us to move forward there for a sustainable, stable environment. You know, I'm very willing to do that. Now, drug will come first for reasons, well, first of all, of values and size, not just of the urgency, but I'm not underestimating medical devices diagnostics. We need to see what we can do by following best European practices. In drugs, we followed primarily Belgium, Portugal, and Germany that have a similar model, Belgium primarily, but the other countries as well, to do something similar for the medical devices and diagnostics. At any rate, thank you very much for the invitation. Now, please allow me to insist, since you talked about pharma and drugs, and I will give the floor to Mrs. Barmpetaki later and Mr. Gkikas. Now, you're talking about drugs. I would like to ask you what you're planning to do, what's in the pipeline to reduce these refunds, to improve the tax environment. Now, these have been the 9 months of incessant implementation of measures. Now, some of you know it, some others are known just by the market. I don't think we've been inert. But what I've said in our initial meeting, we've done everything, the locked treatment protocols, the digital contact of all these tests, and bring the tests and the results in the file, the active part that is starting in November. Whatever was brought on the table as an idea to build an environment here with fewer such refunds, we have implemented. And truth be told, that the goals we had set early in the year to have in 2024 200 to 300 million fewer rebates and clawbacks than we had in 2023, I can say that it will be achieved. Expenditure plus funding is plus funding is moving towards that area with a similar target. If we have a similar target for next year, I believe that we will be in late 2025, early 2026 in a more sustainable rebate and clawback environment. So the main political goal is to reduce the distance between the overall rebates and clawbacks in the retail with the overall refunds in the fee and the hospitals. Now the distance is big. In 2023 it was reduced, in 2024 it will remain large, and you may consider this as our main goal, to see these two converge, not just by reducing that in the retail, but increasing the other part of the market. I would like to hear what you have to say, Mrs. Barmpetaki, and also to talk about the innovative drugs, and to see what you feel are the problems we need to meet.
Very much, Mr. Mangiriadis. I believe that we are here today in order to have this very important discussion. Now and in the coming years, we are going to decide on how we can practically design a health system that will ensure the access of patients to innovation. And just like the minister said, this is exactly what we're interested in. We're not interested in only just making up some measures. We want to have an environment where the patients who need treatment at a given moment, following the right protocol, can actually get it in Greece, just like they can get it in other European countries. You know something, Mr. Mangiriadis, the numbers have started to show that unless we close the gap to which the minister referred between innovation and the conventional treatments, we will see phenomena that already exist actually, on the basis of which many treatments will be launched in other European countries without being able to find a specific or similar path in Greece. And we cannot possibly allow this to happen. The minister said, very aptly, that the patient name or effect can temporarily give an exception or solution, temporary solution, but this is not what we want. What we do want as innovative industry is to make a system that will guarantee access to the treatment for the patients that need it. Just like we have seen an improvement of the life expectancy, and we have seen solutions for other sectors like neurology, where in the past there were no solutions. We want to continue doing the same in the future. But we talked about a critical point that asks for the signing of a memorandum of cooperation, because if we all want to operate in an environment that will be predictable and, if not stable, at least predictable and sustainable for the future. We are talking about innovation channels where the overall rebates and clawbacks exceed the 75% for hospitals, 65% for drugs of high value, I would like to say, high value drugs. I prefer this term to high cost drugs. But already we are talking about some limits that impede us from finding new treatments. So just like the minister said, I would also like to say that indeed this dialogue with the ministry has started. Our effort to get best practice from abroad has started. So if our main objective is to ensure access for all patients, we need also to find ways so that these treatments will find a pathway of implementation here in Greece, which of course depends on funding. Yes, we need funding. The population that is aging has increased needs. Apart from the technology and the biotechnological solutions, then we need to come up with a framework for businesses. What do I mean by that? And we have talked about it with the minister. We need to come up with a model that will set a limit for rebates and clawbacks. And yes, we want to have better outcomes in the future, always compared to the past. What we need to make sure is that we will change the course of action in the future. And this can happen with the utilization of data, with the saving of resources wherever we can. We want to do that. We don't want to have an inflationary system that we talk about increase of expenditure. No, we want to make savings wherever and whenever we can, so that we can then distribute these resources to the system in order to meet the needs where we currently can't. So this is the principle of the Memorandum of Cooperation that has a 3-year deadline that will be observed by the state, of course, the Ministry of Health, with the participation, of course, of Ministry of Finance and Development, but also will give the possibility for new ideas to be expressed. This is where we stand right now, Mr. Mangiriadis. Thank you very much. I will come back to the Memorandum of Cooperation a little bit later on. Mr. Gkikas, I would like us to talk about the value-based healthcare, which is a term used in the industry. During the last few years, discussion is taking place about this turn to a value-based healthcare, which allows better outcomes for the patients, since the treatments will be individualized. So the question is, how can medical technology contribute to the development of this value, and what does it mean to perceive technology as an investment and not just as a cost? The minister previously talked about that. Basically, we need to talk about two things when we talk about that. The first is innovation. That brings about significant benefits. And these benefits, especially when we talk about medtech devices, pertain to early diagnosis, which means that we can identify the problem early on and thus have more chances of treating it, but also better information given to the patients who will be early notified in order to take their exams. And I would like to tell you that 20% of patients do not have an MRI because they are afraid of this device. So the technology can ensure better diagnosis and better services to the patients. Moreover, what we achieve through innovation and what constitutes value is that we make it accessible. The minister also said previously that now someone who lives in a remote area and who is not that familiar with medical technology have some tests and then send these tests to someone more experienced or someone who has better knowledge of the diagnosis in order to find a solution. So what do we achieve in that way? That we can actually prevent the necessity of moving from the remote area to another place. And this, of course, is a benefit. Then another important issue is the value of data. The volume of data is enormous, but unfortunately, we're not making the most of this data. If we do, we will get better outcomes. We will, at the same time, reduce the volume of work for the workers, for the employees, who will have faster workflows. So when we talk provision of health services on the basis of value, basically what we mean is healthcare that has to do more with health than with treatment of disease. We are trying to identify the long-term benefits stemming from this technology when, for example, the patient will not have to go to the hospital since they will be able to use some mobile devices, when they will be released earlier from hospital since the treatments will be more targeted. So if all these materialize, then the cost of innovation, which in the beginning seems enormous, will later be perceived as value, because the patients will get better far earlier on. So we need to perceive the medical technology as an investment and not as a cost. Okay, thank you very much. We all understand that when someone is a minister in health in Greece, they are at the same time minister of development. Ms. Barmpetaki, I carefully listened to what you said, and I would like to ask the following. Nowadays, in Greece, can we ensure a business environment that ensures stability, predictability, and stability, so that the big companies that operate in the sector can continue to invest?
Well, this is not my main competence in this portfolio, okay? Yes, we can understand this. Be that as it may, now, the government is single, and the government policy must have a uniformity, as it were, and a common goal. I fully accept that one of the goals and the purposes of signing this memorandum of understanding between the government and the pharma industry is to improve the business climate, as it were, and the environment and their investment decisions and prospects. This is one of the things that are of interest. We need to improve the access of our patients to innovative treatments, and another thing is to ensure that we will not be outside the global investment map and the global investment interest of these big companies. Now, the fact that they chose to come to Greece and hold their annual conference, these colossal companies understood that there is a country that's called Greece, and this meant something. And what we had there at the European Council, and we raised the flag, and it may sound a bit superficial, with a Greek leadership in the discussion, I believe, raised the flag that we are a government that can understand what a company needs to promote investments. Huge investments have become through the investment clawback, not just from multinationals, just Berger Ingelheim and another couple of them involved in clinical trial, but we can do this on a more stable basis in the years to come. Right, we're eagerly expecting it. Labrina Barmpetaki, you talked about a memorandum of collaboration or understanding between the government and the pharma industry. What will be the content of this pact? Let's break it down so that everyone here will understand. And what are the proposals of your industry? Right, great, right. So let's talk about what we have designed and what we have foreseen, because when we started thinking about it as an innovative industry, we put the patient in the center and the access to the treatments when needed. But for this to happen, we focused on 5 pillars, and this is what we are presenting to the Minister and discussing with him. We started today, this morning, but we will continue with the quantification and the modeling of it. So the first pillar has to do with investments and funding. So there we start by saying, what are the needs of the system in order to cover patient access in the next years? Now we're talking about a 3-year pact, 2025, 2026, 2027. So if we come up with a budget prediction for this, what does this mean for the companies? What is the maximum or the percentage of refunds that we are called upon to participate in? We need to discuss this and predict it, because as we saw year after year, this has become unbearable as a plan. Third, when we agree on the numbers that need to be included in the funding, how can these be ensured and secured and earmarked from economies and savings from the system? So we have already started discussing with the ministry proposals that will have some of that funding brought into the system. And we want to see what this means year after year, year in and year out. Because like the minister said, we don't want a system that simply increases in terms of growth, but we still have these mandatory refunds. But we need to change this balance. Second pillar, structural reform and design of the organizations in order to allow us to talk about fast-tracking the procedures, but also facilitating the outcome and evaluation and assessment of treatments. You know, we as the PIF have examined what other countries are doing, and we need to enter a healthy triptych that from the entry of a treatment, the HTA, assessment, negotiation, quantification, and its introduction in the health system, we must have some sort of coordination. So we're trying with our proposals to see how we can simplify some processes and procedures, or whether there are some steps that can be taken by other economies in the system and bring them forward. For instance, how can we leverage treatment protocols? How can we use the data we have? Which organizations must see, access and utilize these data in order for us to be certain, as well as the health system, that a new treatment does not simply come with a budget and a cost. It offers a value that will be measurable in the health system for the patients, the hospitals, but also the general multiplying factor, because we want citizens who will be productive. Third pillar, incentives. Now there, I think that the experience of the minister in the Ministry of Development will be very helpful, because I believe that here too we can revise of which incentives we can have as an industry in order not only to be able to survive, I don't like this word, to survive. When in Belgium they created this collaboration pact, they were talking about a plan for development and growth, and this is how we want to look at it. So what are those incentives in terms of tax and investment that can help? And here I think that we have a glorious field to walk, because we want to put Greece on the map again for clinical trials and projects that will bring growth and development in the country. Which leads me to number 4, which is which commitments we as the industry can guarantee. Well, of course, it's the introduction of new treatments, but how? With what projects, with what services to the patient, with what help to the health system? This is what we're here to discuss. And last but not least, to summarize everything, governance. No pacts or no framework of agreement can flourish more than a vision of a few people unless there are goals, KPIs, and organizations that can see how these goals are progressing in order to make corrective actions. This, in a nutshell, is our proposal as the PIF. Thank you very much. Mr. Gkikas, your problems, the ones that you deal as the sector, are which, and what do you believe that could be done differently?
Look, the medical devices in contrast to drug, have a long life. So one should make a forecast, a prediction, not only about how these will be introduced to the hospitals, but how they will be designed in such a way as to follow the developments in the medical sector in the future. At the same time, they need to be integrated and operate as a resource in every health structure, in every health unit. They have to be people responsible for their maintenance, so they need to be trained, and they also need to operate harmoniously in all health units. At the same time, the health system needs to be able to check them and to monitor them, both in terms of design and planning, but also in terms of operation and withdrawal from the system. And the fact is that there is a fragmentary approach to the way that this technology is managed or is designed or adapted in the health units, and then how it is maintained and withdrawn. And what we are looking for, and exactly because our role in this framework is long and important, is certainty, if you like, and stability in this framework of cooperation with the ministry and the public system, so that we can prevent surprises, because, as I told you, this technology needs to be supported by us, and at the same time there has to be a continuous upgrading of the health system. So a very important point for us is the provision of incentives so that this technology can actually arrive in the health system, be it private or public, and at the same time what we want is to be given the opportunity to be sustainable and healthy in a business environment that will not have any negative and unexpected surprises, so that we can then introduce and bring more innovation in the country. You talked about the stability of the framework. I don't want to insist on that. I would like us to close today's short discussion the way we started it. We started it by talking about the Draghi report, and I would like a short intervention by all of you. Minister, you know a lot about the health sector. You have served in the ministry repeatedly. Do you believe that the health sector in Greece can constitute a lever of growth just like tourism is? We have the scientific personnel, there is the possibility for innovation, there is the possibility, at least there was a discussion in the past about creating the Florida of Europe. Anyway, the point is there are some positive aspects. And I would like to ask you, by looking at the future, beyond the term of this government, do you believe that health sector can offer a lot to this country? I believe that this is already the case. If you take a look at the investments of big funds abroad, CVC, for example, and if you see the investments that big companies are about to make in Greece, we will have some funds from Abu Dhabi. You will realize that the health sector is indeed a sector that is attracting investments and significant funds. So yes, I'm convinced that health sector can play an important role for the future, and it will give the possibility to Greece not to compete with the German industry. Okay, this is not realistic, but we will be able to change the deindustrialization process that has started in the 80s and make some positive changes for the future, which will mean that we will be better. We'll not be the protagonists, but we will be better. And when it comes to the possibility of becoming Florida of Europe, no. In a country where the population is aging, and this is actually a problem that does not pertain only to Greece, but to the West overall. So in such a country where the population is aging, large movements of population, purchases of real estate, and stay in a country that does not provide quality health services, all of these are contingent on the development of the health sector and of the development of the real estate sector of the country. So in that sense, Greece, yes, can play a far more important role than it does today. And I repeat that we are living in a fast-changing world. The idea and the notion of digital nomad will prevail in the future. Nowadays, Greece is lagging behind when it comes to that because we have some structural problems. But in the coming decade, these problems will have been resolved. So yes, Greece can actually aim at this objective of becoming more competitive. And we have already made the first steps. And I believe that the big companies that have decided to operate in Greece have made this decision because they have seen the future of the country. And what we want to do is to make their choices easier and their life easier. Ms. Barmpetaki, I believe that we live in a country that will go through significant changes in the health sector, in the scientific sector in the future, and it is up to us to perceive this as an opportunity. We should not be focusing only on the challenges that we are grappling with, but also on the opportunities that are emerging. And in order to become a little bit more specific, we live in a country where the human resources are highly specialized, highly skilled. We have health professionals that can support scientific work and clinical studies, and we need actually to make the most of this in order to claim the position that we are worthy of. Because yes, there is this competition between Europe and United States, but also in and between the European countries. So that is why we need to make sure that Greece will be a pioneer in new technologies and at the same time a bearer of development of new technologies. But apart from the fact that we can actually increase the life expectancy of patients, and this is proven actually, I would like to talk about the fact of the significant trends that are emerging. Trends pertaining to biopharma companies. We should not forget that we want to reverse the brain drain and we want to enter the era of brain gain. So what we do is to offer specialized jobs, not only in our companies, but for every work that we offer, we create at the same time an additional force, since we involve project management companies, consultancy companies. So why shouldn't we be able to attract more scientists that will be better paid and that will contribute to the development of the country? And why aren't we in the position to envision hubs and centers where people will be working here in Greece, however, have the possibility to have a career abroad? And that is why I would like to close just like I started. We are at this turning point. We are operating in a very critical pillar. So this rationale of having this memorandum of understanding and cooperation will allow us to decide about this ecosystem and the form that it will take in the future that will then contribute to the development of the country. Mr. Gkikas, you have the floor.
Right. I will agree that the next 10 years will bring on changes and innovation we haven't seen in 100 years. This is certain. We can see it and we're working towards it. What we want is to create a framework within which this innovation can reach Greece. Or even better, I believe that Greece is at a stage, at a very crucial crossroads that can lead in the adoption of this innovation and to be far ahead in other countries that quite possibly produce medical technology, to adopt it and to give incentive to the use of AI and new treatments to come to Greece to the benefit of one and all. What is crucial is the collaboration and partnership between the public and private sector, which is something that must be done at all levels. So I should like to thank the Minister, Mr. Georgiadis, Mrs. Barmpetaki and Mr. Gkikas, thank you very much. And it will be Mr. Suliotis who will take our place here on stage. Thank you.